We're doing the transfollicular brow lift, and again, our scalpel is very horizontal, and this is a filleting type incision, and we want it to be a random undulating incision. We want it about 5 millimeters behind the actual hairline, and by doing this, we're going to cut across the base of the follicles, which will preserve them. So although it looks like some of this hair is coming off, actually the roots will be preserved. And we don't want a straight line incision. We want the incision to follow the patient's natural hairline, again, in a filleting type of a situation. Technically, it's a facelift for the brow. It's the same type of a procedure as a facelift, and that's why it's so very stable. And we are under the dermis and above the frontalis, and so we begin our dissection. And again, this is a subcutaneous procedure, and using the scissors to dissect. So now we're looking inside the flap, and you can see the supraorbital and supratrochlear neurovascular bundles, and that's a great thing about this procedure is you can actually see all the vessels and nerves, and you can preserve them. So that's what the inside of the flap looks like. There's no significant anatomy in the midline, and so we dissect the flap. When we get around the neurovascular bundles, we angle the scissors, and we must dissect below the brow to get enough freedom, and this allows us to elevate the brow for the lift. Push the scalp forward and pull the brow. So we're going to have about 20 millimeters of excess skin, usually right about 15 in the midline and about 20 laterally. And this is why this is a stable procedure, because this is the excess skin that will come off. So what we're going to do now is to make a reciprocal incision and remove this extra to have natural scars, to have this hyper beveled incision. And what you have to do is match the skin excision with your previous beveled incision. And it's very important that this is very beveled to have a natural appearing scar. And you want it at exactly the same angle as not to have a step off, and then that'll close just perfectly. Size this skin flap again with a hyper bevel and put a couple of 5/0 gut sutures there, and these just heal excellent. In the event that it doesn't heal the way you want it to, which is a very small percentage of the cases, we'll go back and laser that. But you can see we've removed about 20 millimeters of extra skin, and that is going to keep this brow up. So here's our completed incision. And although it looks a little bit bumpy right now, it really does heal nicely because it's so beveled and thin. And in a matter of weeks, it'll blend in fine. It's rare that you can even see the incisions unless you really look at them closely a couple months after surgery. So that's our transfollicular brow lift. And you can see that our brows are elevated equally and subcutaneous.